ACL tears, can they be treated without surgery or not? A randomized controlled trial of good quality per the Pedro scale from Philbay et al. Followed 120 physically active patients for 5 years to analyze extent of ligament healing with the ACL OAS score and long-term function with the KOOS score. Patients with full ACL tears were randomized into two groups. Group 1 was conservative treatment with the personal option of getting an ACL reconstruction. Group 2 was immediate ACL reconstruction. The ACL OAS score determines ligament healing per an MRI. 0 is reflective of a normal ACL. 1 is reflective of continuous ACL from bone to bone that's thick. 2 is reflective of continuous ACL from bone to bone that's thin. And 3 is reflective of a complete tear. In 3 months' time, ACLs treated conservatively notched healing categories, that's ACL OAS 1 and 2, in 71% of patients. 57% of those patients were grade 1, and 14% of those patients were grade 2. The KOOS measure determines knee quality in different categories based on a 0 to 100 scale. 100 is no issues, 0 is most issues. I went ahead and simplified the scoring by categorizing these per an F to A scale on this video. As a quick summary, 5-year scoring metrics normalize across both of these groups. Healed, naturally treated ACLs gaining the edge over ACL reconstruction. But there's something to consider here that I'll touch on at the end. For now, I will focus on the 2-year marks for conciseness. Baseline scores for both groups averaged around 37, that's an F- in each category. So, after 2 years' time, for symptoms of swelling, grinding, clicking, or catching, here's the results. Natural treatment. If the ACL healed, the grade is an A-. If the ACL didn't heal, the score was a B-. For invasive treatment, the score was a C+. For pain with pivoting, straightening, bending, walking, with stairs, or with sitting, here's the results. For natural treatment, if the ACL healed, the grade, A+. If the ACL didn't heal, B+. And invasive treatment, B+. For knee problem awareness, lifestyle modification, decrease in knee confidence, or knee difficulty, here are the results. For natural treatment, if the ACL healed, the grade, C+. If the ACL didn't heal, the grade is F-. And for invasive treatment, the grade is D+. For squatting, running, jumping, pivoting, or kneeling, here are the results. For natural treatment, if the ACL heals, you have a B+. If the ACL doesn't heal, you have a D+. And with invasive treatment, you have a C-. In summary, natural treatment is better than invasive treatment, given that ACL healing occurs. Is there any way to affect ACL healing, or is this rate, which from the study was 50 to 70% dependent on time, set in stone? The answer to that question can be found in this study. Researchers examined ACL healing rates and knee laxity with a new rehab strategy called the cross-brace protocol. Normally with ACL tears, the strategy with the goal of ligament protection is to immobilize the joint into extension following reconstructive surgery, while this protocol starts the knee in flexion with the goal of allowing the ACL fibers to reconnect. What were the results with using this method? 90%, that's 72 out of 80 participants, showed healed ligament at the 3-month mark, 50% at ACL OAS 1, and 40% at ACL OAS 2. These were former full tears, now continuous from bone to bone. How did they fare from a function standpoint? Both groups showed excellence in terms of low pain levels, good stability, no locking, swelling, limping, no issues with stairs, squatting, and no need for gait support at the 12-month mark. For return to sport in 12 months' time, the ACL OAS 1 group had rates of 90%, while ACL OAS 2 had 58% returning to sport. How did they fare in comparison to ACL reconstruction? Well, the re-injury rate for ACL reconstruction is about 20%, while in this study, there was just a 14% re-injury rate. Now, there's one thing I want to touch on. In the prior study, the 71% healing rate dropped about 20% in 5 years' time. Why would that happen? How can these rates of healing just drop? My hypothesis, this study only rehabbed the ACL rigorously for 12 weeks' time, then nothing for 5 years in relation to direct ACL training. What's amazing isn't that the ACL healing rates dropped 20%. What's amazing is that the ACL healing rates didn't completely plummet to 0. Imagine what could happen if after those 12 weeks, these patients utilized exercises designed to make the ACL the limiting factor. Imagine what could happen if they continued strengthening their ACL with said exercises for 5 years after the fact. My own ATG journey started in 2019. I and hundreds of other members and coaches are living proof of already solidified truths. The ACL adapts just like any other structure of the body, and the body will adapt that structure in relation to need. If we tell the body, hey, in this position, if my ligament doesn't adapt, I'm not going to succeed, the body will begin incrementally building up the foundation of that ligament, brick by brick, week by week, month by month, year after year, until you are left amazed at what you come up with. So what's the answer to the question? Based on these two studies, with natural treatment, a fully torn ACL, when given a protocol that leads to ligament healing, is better in terms of functional outcomes and patient satisfaction than ACL reconstruction. The key is ligament healing. If there's anything to glean from this, it's understanding movement is medicine, but the type of movement is immensely important if the medicine is going to achieve its desired effect. You wouldn't use Neosporin for a headache. That's a medicine, but it isn't the right medicine for the symptom. Comparatively, without any direct ACL training, the rates of healing dropped 50%. Again, these are athletes. They're still active. They're doing plyometrics, sprinting, cutting. So why isn't the medicine working? It's simple. They aren't targeting movements that make the ACL the limiting factor any longer. If you want to maximize knee ligament potential, then you have to target movements designed to do just that. First, bring blood flow into the knee with reverse treadmill. Challenge joint ability with reverse step-ups and split squats to maximize potential for controlled full range squat with chains. Notice I didn't put sets or reps, days of week. This is because I don't want you to get confused. I didn't say follow a program to heal your ACL. Yes, ATG is a program, but the program isn't the magic. It's the positions and principles of the route. If you apply short, long, and joint range concepts to your specific scenario, you won't get confused about all the nuance that exists. Get strong at your weakest link, consistently, intently, and patiently, with greater load, volume, and range that you can tolerate, and long term, you won't even recognize yourself anymore.